Hi, this is Dr. Rob Peltier, Chief Medical Officer at NORTHOAKS Medical Center in Hammond, Louisiana. I'm here to give you an update on coronavirus. Last week we produced a video here at NORTHOAKS giving some details about coronavirus. I wanted to give you a small update as well as tell you about some of the things that you can go to, reliable websites, and to answer questions that have come up on our website. Please refer back frequently to our website. We will do probably at least a weekly update, but more often if needed, depending on as things change. But we'll be glad to help be a source of information for you. A viewer on Facebook recently asked why, if the coronavirus is new, have we seen it on the back of a Lysol can? I think it's a good question that will give us some information about coronaviruses. First of all, there are lots of different coronaviruses. There are not only different subsets within each species of this particular virus, but in this case what we have is beta coronaviruses. They're different than the most common types of coronaviruses which we see, and which certainly can cause a common cold. That's why Lysol puts that virus, as well as many different viruses like rhinovirus and adenovirus and influenza, on the back of their can, because the same mechanism that kills the other viruses generally kills those viruses, as well as bacteria and other pathogens. We recently received a question also about what novel meant in a novel virus. Coronaviruses come in many different species, and all viruses mutate. When we get a change in the DNA through mutation, many times it just causes the virus to be an organism that doesn't cause any illness. But unfortunately, with enough mutations, we will get an illness that creates a new or novel coronavirus. So when you hear the term novel coronavirus, what you're dealing with is a virus that's new, probably to the planet, and subsequently, when we don't know much about it and it does cause disease, we have to gather information because every virus can affect us differently. We also had a question online about children and how they are affected. Recently at a public forum, I talked about how the studies right now show that children are not affected. What I meant by that is they are not affected to the same level as adults. In most of the studies that have been done, it has been done with hospitalized patients, and we've seen less than 1% of the people needing hospitalization have been children. We certainly have had confirmed cases of children, not only in the public that feel healthy, but children that have been hospitalized. It's just a vast minority of the patients that have gotten severe disease. So luckily, what we've seen is that children seem to be spared, for the most part, from the most severe forms of the disease, the pneumonia and those things that have caused death in a few of the patients. Maybe the most frequent question that we receive is it safe to travel? At this point, I don't know what to tell you. I think everybody's going to have to make their own decision. What I can tell you is that we've certainly seen cases here in the United States, so staying home does not necessarily mean you're safe. If someone asked me would they go to a country with a high propensity for the disease right now, and those countries listed on the CDC website are China, South Korea, Italy, and Iran. Those 4 countries specifically have large number of cases. I would tell them at this time I would weigh your options and determine what's appropriate for you and your family. And as the CDC says, all unnecessary travel should be discouraged. And I would say the same, I would repeat the same thing. In particular, I've been asked about cruises. You know, that's a favorite pastime of many of the people here in South Louisiana. And cruises carry their own risk because there's so many people in close proximity. We've seen many cruise liners deal with the issue. It's going to be, again, a personal preference if they are, you know, how do you deal with risk? At any time you could stay home and be sick as well. So I wouldn't tell people to not necessarily go, but they need to determine it. I would probably suggest that people with significant comorbid conditions always be cautious when they take a cruise. Wash your hands frequently. All of those respiratory hygiene things that we do, because cruise ships are unfortunately a lot of people in close quarters. We know that many of the countries, some of their strategies to prevent the spread of illness has been to try to stop large gatherings of people. A cruise ship by nature is a large gathering of people. So do your research, see how appropriate it is for you to travel, and consult with your personal physician before you leave about if it's appropriate for you. We've also received some questions about masks and how they protect people. You've seen a lot of things back and forth, especially on our news feeds, about masks and who's appropriate to wear them. Masks have a number of different protective abilities. Most masks, the masks that you generally see that we call surgical masks, which are the ones that kind of snap behind the ear, they have a little elastic and they cover the front. Really, they are not viral proof. The pores that you move air through, and the fact that they're not fitted to the face, do not really prevent you from getting a virus if someone coughs or sneezes on you. So for the most part, it's not recommended that people in general walk around and wear them. Where they are functional is if someone is sick and they put a mask on and they sneeze or cough, it's caught in that small area of the mask and it doesn't aerosolize and spread. We know that a sneeze, for example, can go from 6 to 8 feet of aerosolizing a virus. So if we can contain that in a small area by sneezing into a mask, that's the function of those masks. We have, there are more advanced masks that healthcare personnel use, what we call an N95 mask, and those have to be fitted. There's a special procedure that we do here for healthcare personnel to make sure that it fits around and seals to the face so that we can filter the air that comes through. Those masks really should be reserved for healthcare personnel that have been properly fitted and know how to use them appropriately. So how do we prevent getting COVID-19, coronavirus, and or any other infectious disease that's aerosolized? It's a hard task, I'll tell you. In general, the most important thing we can do are the everyday measures that prevent us from getting sick. Those things are washing your hands frequently, and that's a good hand washing. Using soap and water and scrubbing for 10 to 20 seconds of good scrubbing, but at least having the soap on your hands for 20 seconds. A good rule of thumb is to sing the ABCs while you're using soap, and then properly washing them off with plenty of water is probably the best preventative. Other things that you can do is, if you are sick, stay home from school or work. Try not to spread an infectious disease, whether that's COVID-19, a cold, or the flu, or any other thing that you have that's causing you to feel ill. Some of the things you can do if you're coughing: carry a handkerchief or carry something to cover your mouth when you do cough or sneeze. If you don't have any of those available, the recommendation is to cough into your antecubital fossa right here, your elbow right here, not into your hands, because then you've now infected your hands, and we wipe our face and shake other people's hands and touch things more frequently. We don't touch things with this part. So it's sort of your makeshift handkerchief area. All of those things help. If you don't have access to soap and water, carrying some hand sanitizer around, especially if you're ill, and using it frequently. You need to rub. It's the alcohol that in that substance that slowly dries, so you keep rubbing your hands until your hands are totally dry, and try to get into all the little cracks and crevices and under your fingernails everywhere, because that's where we harbor bacteria and viruses and other pathogens. We've also been asked if NORTHOAKS is ready to handle a case. Well, of course we are. We're a hospital, and we have lots of infectious diseases, whether it's influenza, tuberculosis, heart attacks, you name it. We have to always be ready, not knowing what will walk through our door. Now, that being said, We never know when we have a new vaccine, virus or anything else that comes through our door. So we're going to treat everyone like they're infected potentially. You'll be asked questions about, are you sick? Hey, you know anybody that's been sick? We always ask those questions, and when we are, we may ask you to put a mask on your face. We certainly have the equipment, the personnel, the critical care physicians, the infectious disease physicians to take care of a coronavirus patient that comes here if we need to. Let's hope it doesn't happen, but we're prepared if it does. A major question has been about testing for the coronavirus and when it's appropriate, and does NORTHOAKS have testing. The CDC has laid out specific guidelines about who gets tested and who doesn't, identifying what they call a person under investigation. Right now, the testing is limited in certain areas throughout the United States, so there's only certain labs that have this. We've been told by the end of the week there will be many more regional areas to test. They're also fast-tracking some of the major private laboratories to be able to test. So I'm confident that within a week or two we will have plenty of tests and ability to test in a quick turnaround. We definitely have the ability to test now by sending it off if it's an appropriate patient, but we're talking about a couple of days turnaround to confirm. That process, that ability is getting a whole lot better. It just takes a while to ramp up. Those tests are very specific and really test for, looking for segments of the RNA to confirm that it is a coronavirus, and specifically this coronavirus. So we do have the ability to test. If we have a patient under investigation, we will call state health authorities who have a 24-hour hotline that they answer and tell us, yes, this is an appropriate person, and we will collect the samples and send that off. And again, we hope by the end of next week for sure that tests are much more widespread. I would highly suggest that all of you that are watching this stay informed about all the changes that occur. Go to reputable websites. I personally like to go to the CDC website, the WHO website, or the World Health Organization website. I, as a physician, look at the Journal of the American Medical Association, JAMA, the New England Journal of Medicine, and Lancet, which gives us many of the clinical articles, which certainly are relatable to the general public as well. There are a lot of websites that are given a whole lot of false information. So again, you'll see a lot of, the term now is fake news that's out there. Confirm it before you continue to spread rumors, because that incites sometimes people to be more worried than they necessarily need to be, and we don't need that right now. Here at NORTHOAKS, we welcome questions. Keeping the public informed is probably maybe the best defense we can have as a community to help with this current issue. Wherever you're watching this particular video, give us feedback on what you want to know about. If you have a question, a particular question, please send it in, and we will answer all the appropriate questions that come across any of our websites, whether that's Facebook or Twitter or any of the other places that you're looking at it. We monitor that frequently, so please submit your questions. We'll be glad to answer them.